26% of Australians will experience an anxiety disorder at some stage in their life. And so, what is anxiety? It's basically our mind and body's natural response to a perceived threat. And it is actually a very important and adaptive emotion that helps us to survive and in some cases thrive. Think of it a little bit like our body's natural alarm system, like a smoke alarm. If I was walking down a street and a bear came up and tried to attack me, I want my alarm system to go off. Otherwise, I'm probably in a lot of trouble. It's going to get me ready to basically get into fight or flight mode, which might be something you've heard of. Either get out of there or fight off the threat. Now, this is where anxiety symptoms come into play. Often when we start to feel anxious, which most of us do sometimes, we might start to notice things like our heart rate increasing, our breathing gets faster. This is just our body preparing, and it's basically things like increasing blood flow and getting more oxygen in. You might also notice things like feeling a bit nauseous in your stomach, or even getting kind of some butterflies. That's also something really normal. It is blood flow going away from your digestive system because we don't want to waste time on digesting while we're getting ready to run away from a threat or fight it off. Other changes you might notice are getting a little bit hyper-focused on the threat or worrying about the threat. And also things like our hands getting shaky or hot. Again, these are all really normal changes in our system in that fight or flight mode. Interestingly, our body and mind don't differentiate between physical threat and psychological threat, and that's why you might get a lot of those same emotions when it comes to things like giving a presentation at work or going into an exam. And in moderate levels, that anxiety can actually be really helpful to help us stay alert and focused and future-oriented and actually do better. However, when the anxiety gets higher and is at those more intense levels and is disproportionate to the threat, this is when the symptoms of anxiety start to cause a problem. They start to interfere with the life we want to be leading, and they can cause a lot of distress. And that's when we start to diagnose things like anxiety disorders. It's a little bit like having a smoke alarm and not being able to differentiate between whether it's going off for fire, a threat, or burnt toast. And so this is where treatment for anxiety comes in. Things like cognitive behavioral therapy, or CBT, can help us learn to recognize the alarm, think differently about those threats, and respond in more adaptive ways that help us to manage anxiety, feel less distressed, and lead the life we want to be leading. If you would like any more help in managing anxiety or learning more about anxiety, any of the registered psychologists on My Mirror are able to help.